Hi there. My name is Dr. Micah Wald, and I'm the Nutritional Director at Integrated Medicine of Mount Kisco, a holistic medical center in Westchester, New York. Right now, Mr. Sonny Stewart, a certified nutrition specialist and master's degree in nutrition, will ask me a series of questions on the topic of fatigue. If you have some further questions for us, please don't hesitate to give us a call at our clinic at 914-242-8844 or send us your questions in email form on our website at www.intmedny.com. So, Sonny, shoot away.
Hi. All right, Dr. Wald, first question, true or false? A depressed immune system is the primary cause of chronic fatigue syndrome.
Well, that's an important question. First of all, there's chronic fatigue syndrome, and then there's just regular fatigue. There are many, many different causes of fatigue. And I first should say that fatigue is not a disease. It's just a symptom. I mean, someone could be fatigued because they exercise too much. They could be fatigued because they exercise too little, maybe because they eat too much refined and processed sugars, or they're stressed, or they might actually have an immune problem. They might have iron anemia, B vitamin anemia, vitamin C anemia, a viral infection, bacterial infection. As you can see, the list goes on and on in terms of what might cause the fatigue. So to answer this question correctly, is chronic fatigue or is the immune system the primary problem in causing chronic fatigue? I would say most commonly not. Far more people are iron anemic or have nutritional issues, stress issues, sleep issues, and even maybe toxicity issues that might cause their chronic fatigue. But in all of our patients, we do look at the immune systems because they're all affected by any of those things that I've said to more or less of an extent, or sometimes not at all. The immune system is not always involved in chronic fatigue system. And by the way, when I said immune systems, when we test them, there's looking at white blood cells, for example, the eosinophils or basophils or neutrophils or lymphocytes. And then there's the humoral immune system, which is composed of immunoglobulins like IgGs, IgMs, IgEs, and As. And there's other aspects of the immune systems as well. So we'd want to look at those for each person to figure out if that's part of the scenario with them.
Okay. Question number 2, and I'm going to ask you this in a multiple choice format.
Okay, I'm being tested here.
Okay.
Go for it.
Which of the following is the most likely cause of chronic fatigue syndrome? Is it A, stress, B, poor nutrition, C, food and environmental toxins, D, viruses, bacteria, fungi, and parasites, or E, all of the above?
Okay, I'm going to guess all of the above. As you can imagine, there are so many different causes, as we've just stated, that might cause either fatigue or chronic fatigue. The only way to know for sure is to look at a patient's lifestyle through very careful history taking and questionnaires. And we have very comprehensive metabolic screening questionnaires which look at each area of the patient's body to help discern where the problem might be. But sometimes it's a combination of all these. So there's no way to give a straightforward answer to that. But I will say just one quick thing about stress, because I'm asked this all the time, and I know you are as well, that stress is always a factor in healing. It's also always a factor in predisposing one to chronic fatigue or any degenerative disease. So it's always part of our suggestions. In other words, proper coping mechanisms for stress reduction. That's always got to be part of whatever we do.
Okay. Similar to question number 2. Number 3, using a multiple choice format. Which of the following are symptoms of chronic fatigue syndrome? Is it A, lack of energy, B, joint pain, muscle soreness, C, irritable bowel syndrome, D, autoimmune reactions, such as allergies, rashes, or E, all of the above?
Again, as you might imagine, because most of you listening have some knowledge in this area, which is why we're going into such detail here, but all of these can be symptoms of chronic fatigue syndrome or just fatigue. There were studies done at Harvard on students where they deprived these students of sleep for a couple of hours, as many as 24, even 48 hours. And what they found out is that these students had a wide variety of health issues, symptoms, and signs, which included many of the things that you just stated and many others. The point, though, is that the underlying causes of chronic fatigue are almost never appreciated by any one type of medical physician, because these different problems, whether it's irritable bowel or whether it's joint system symptoms, those are already two different medical specialists. So people are referred around and around. Here, at least, we recognize that the energetic problems in the body, which are fatigue, which can be caused from everything from infectious agents to toxins to nutritional problems to electromagnetic issues. The list goes on and on and on. Can cause symptoms absolutely anywhere in the body. And we might not immediately recognize them as chronic fatigue symptoms. So we need that broad range, holistic consideration that many of these symptoms can arise from a fundamental energetic problem in the body, which can have yet further causes.
Okay. All right. Question number 4. This is true or false.
Mm-hmm.
Treatment for chronic fatigue syndrome should consist of acetaminophen, which is Tylenol, ibuprofen, which is Advil, and or aspirin to relieve physical symptoms associated with chronic fatigue syndrome.
Well, everything you've just named is the standard of care in, let's say, an internist's office or a family practitioner's office for fatigue or pain of chronic fatigue syndrome, which is associated with muscle aches and pains or tender spots known as trigger points or tender spots. But taking those anti-inflammatories don't at all address the cause of someone's chronic fatigue. I think that's obvious. We don't have acetaminophen or aspirin deficiencies. And, to be fair, that's not to say that sometimes when all else that, might fail in the natural arena, if that just doesn't do the trick, that these medications shouldn't be considered. But let's not fool ourselves into thinking that we have drug deficiencies. The body knows how to heal. And in areas of chronic fatigue, discovering and managing as naturally as possible through lifestyle, emotional stress, coping mechanisms, sleep, and individual tailoring of diet and nutritional supplements based on laboratory work, whether it's blood, urine, or saliva, that goes a long way for managing virtually all of these people. And I think we've both learned that.
Yes.
Okay.
Okay, final question.
Mm-hmm.
True or false? Coconut oil may be one of the best solutions for chronic fatigue syndrome.
Well, coconut oil is certainly very popular these days and important for a variety of reasons in chronic fatigue. I would certainly put it at the top of my list because it contains a variety of anti-infectious, antiviral, antifungal, antiparasitic compounds. A few of them are capric acid and caprylic acid, and there are many others. But the point, though, is if we simply rely on what might be the thing, for example, if someone has a viral agent that's causing their fatigue, then maybe coconut oil might help them. But what if it's any one of the other causes of chronic fatigue? So if it's iron anemia, you can eat all of the coconut oil you want. If it's hypothyroidism, low thyroid, then we need a completely other set of dietary, lifestyle, and nutritional supplement recommendations. So to say that one thing is the best thing for chronic fatigue syndrome is always wrong. And that's very confusing to most lay people because even healthcare providers, because they consult books, textbooks of, let's say, healing, which go from A to Z with various conditions like fatigue. And if you look in the what to do, you'll have this list of nutritional supplements or foods or lifestyle. But if those aren't the things that a person needs for the unique expression of chronic fatigue, then we've missed the boat completely. So I want to thank you again for joining our Q&A on fatigue and chronic fatigue. And once again, you can reach us at 914-242-8844 or go to our website for questions and other materials at www.intmedny.com. My name is Dr. Michael Walder, Director of Nutritional Services at Integrated Medicine of Mount Kisco, and this is Mr. Sonny Seward. Thanks again.